I'm Dr. Lawrence, and I'm here to talk about concussions. One of the most potentially severe injuries that can be sustained by an athlete is a concussion to the brain. From 1968 to 1990, there was a significant reduction in brain and cervical spine fatalities in high school and college football. The decrease was attributed to a variety of factors, including rule changes, enhanced player education, improvements in equipment safety, and enhanced evaluation techniques by athletic trainers and sports medicine personnel. Now I'm going to show you an example of what a concussion looks like.
Everything's alright. What kind of feeling? I'm high on
Hello, Jeremy. I'm Dr. Lawrence.
Hello.
What can I do for you today?
I think I have a concussion.
Okay, well, can you tell me what happened?
I fell. Yeah, I fell.
You fell? Okay. Did you hit your head when you fell?
Yeah.
Okay. What are some of your symptoms?
I'm dizzy, and of course my head hurts. I can barely walk straight. It's like really hard to walk in a straight line. I feel like I have to throw up.
Okay.
And I can see, but it's like that blurry tunnel vision. I can barely see.
Okay. Well, it sounds to me like you have a mild cerebral concussion. And even though the purpose of a bone is to protect the brain mass, sometimes when you hit your head, it can cause the cranium to come in contact with it, which causes all these symptoms you have. And this type of injury occurs when your head moves back and forth, your brain kind of moves sideways in your head, which causes the headache and the nausea and all that kind of stuff. So I recommend you just going home, just resting. Don't look at any bright lights because that'll hurt your head. So just take it easy and you'll be good. Okay?
Alright, thank you.
Thank you. And I have a lollipop for you. There you go.
Oh,
Have a
yay.
nice day. Have a nice day.
Hello, I'm Dr. Smith. I specialize in ACL injuries. ACL, or anterior cruciate ligaments, are a very common injury among male and female athletes. Female athletes experience 4 to 10 times more ACL injuries than male athletes. The true reason is unclear, but it might have something to do with muscle strength and knee alignment. In the knee joint, a notch or compartment lies between the two rounded ends of the thigh bone. The ACL moves within this notch, connecting the femur and tibia and providing stability to the knee. It prevents the tibia from moving too far forward and from rotating too far inward under the femur. Women have a narrower notch than men. Therefore, the space for the ACL movement is limited. With restricted space, the ACL pinches as the knee bends and straightens out, especially during twisting and hyperextension movements, which can lead to its rupture or tear. Here's an example of an ACL injury.
My anterior cruciate ligament!
Hello, I'm Dr. Smith. What is your name?
Haley Huffman.
Oh, that's nice. So what did you have you come to see me for today for?
I think I might have torn my ACL in my right knee.
How did it happen?
I got tripped while running.
Let's test it out. We'll see. Can you put your foot up here?
Like this?
Yes, just like that. Now what I'm going to do is called an anterior draw sign. What I'm going to do is I'm going to pull your knee this way.
Mm-hmm.
And if I feel, what I'm looking to do is feel a little pop right here.
Mm-hmm.
If I feel that little pop, you tore your ACL.
Okay.
And we'll talk about your surgery later on.
Okay.
Oh, yeah.
Mm-hmm.
Yeah, you can need surgery. Alright, what I'm going to do for you is, I'm going to get my nurse in here,
Mm-hmm.
and whenever she comes in, and you can schedule your surgery. But for right now, here's a nice little brace for you.
Thank you.
Learn how to put it on.
In an interview, according to David H. Perrin, a professor at UNCG, he defines athletic training as a terrific way to combine one's interest in sports, physical activity, health, and medicine all into one. He states that even though the curriculum is rigorous and the clinical experiences are time-consuming, it all pays off and opens the doors for numerous jobs. In another interview, this one with Dr. William Roberts, a professor at University of Minnesota Medical School, states that numerous physicians, scientists, and athletes helped shape his career and helped him narrow down his profession. Advice he gives to undergraduate students who are thinking about a career in exercise science is to find something that you're passionate about and put all your energy into it and develop a career around that.
So here's a brief summary. During training and competition, athletic trainers are responsible for taking care of the athlete's safety and physical health. In case of a possible injury, athletic trainers are usually the first ones to diagnose the athlete's injury. And along with sports medicine physicians, athletic trainers are also allowed to prepare rehabilitation programs to injured athletes. We have studied in Chapter 5 that female athletes are more likely to experience ACL injuries than male athletes. This is because women have narrower notch between the femur and tibia, limiting ACL movement. Women have wider pelvis than men, which increases the risk of ACL tear. Women produce hormones such as estrogen that loosen the muscles, tendons, and ligaments. Research has proven that during the menstrual cycle, a woman's knee becomes looser than usual, therefore she's more likely to experience an ACL tear. Lastly, women present less muscle strength than men, so they depend more on the ACL than the muscles to hold their knees in place. It is also useful to remember the common symptoms of a possible concussion, and those include headache, nausea, vomiting, dizziness, balance problems, trouble sleeping, drowsiness, sensitivity to light or noise, blurred vision, difficulty remembering, and difficulty concentrating. Now here's our question for you.